Okay. Good afternoon, ladies and gentlemen. Welcome to this edition of Live from Surya Hospital, WGI Combines here at Surya Hospital in Santa Cruz in Mumbai. I welcome all the viewers and those who are going to log in today for a brief introduction on what is the field of gastroenterology and what do we mean by that, and also endoscopy. Gastroenterology is a science which deals with digestive problems and anything related to digestive organs, that is food pipe, stomach, small intestine, large intestine, liver, gallbladder, and pancreas. These are some of the main digestive organs we have in our system, and the science related to that means gastroenterology. Now, very important for our audience to understand that uh, about 40 years from now, there were very broad specialties like general surgery, general medicine. And as the science and the concept evolved and the knowledge increased in one particular field of specialty, there was a need for further specialization, and that led to the origin of a specialty called gastroenterology. Now, within the gastroenterology specialty, there are other subspecialties like endoscopy, hepatology, motility studies, and there are further subspecialties called pancreas clinic, then inflammatory bowel disease clinic, IBS clinic. Those are all further subspecialization within gastroenterology. We'll not go all in detail of that, but today I'm going to give you a little introduction that what do you mean by gastroenterology. So this is what gastroenterology means. Anything and the science related for diagnosis and treatment of digestive issues. Okay. So we were going to talk about two things today. In main aspect of gastroenterology today is interventional gastroenterology. So when you talk of interventional gastroenterology means endoscopy. So a gastroenterologist who is able to do intervention like endoscopy, look inside, diagnosis and treatment, that is what endoscopy field provides the gastroenterologist with a very potent arm to do very accurate diagnosis and treatment. Coming to the fundamental question here as to, first of all, I want our audience to understand that there is a lot of myth about endoscopy. First is endoscopy is very painful, it's very difficult, and it is very, very unsafe. So for those people who are not really aware, I want to share with you that I've had an opportunity to do almost 100,000 endoscopies in last 3 decades. And we usually give some sedation to the patient to do endoscopy. So there is no pain, there is no discomfort, and the patient won't even come to know when the procedure is over. So first, that myth I want to break. If you do it properly at a proper center, then endoscopy is absolutely painless procedure. Okay, so that's number one. Somebody has asked me a question on what is gastric problem or gastritis. So I want to tell you something. Any problem with abdomen or stomach that leads to symptoms, we call it gastric problem. It's a broad term. Furthermore, if you talk of gastritis, inflammation of stomach can happen because of various reasons, and the inflammation itself of the stomach is called gastritis. The way inflammation of appendix is called appendicitis, inflammation of tonsillitis. Similarly, inflammation of the stomach is called gastritis. So, what can cause gastritis? Now, there are many reasons for a person to develop gastritis. One of the most common cause is hyperacidity, excessive acid secretion in the stomach, and the most common cause we have found is a bacteria which infects the stomach called H. pylori. So, an H. pylori bacteria causes inflammation in the stomach by breaking the barrier, the mucosal protective barrier, and that leads to injury of the stomach lining due to acid, and that leads to sequence of inflammation, and that leads to gastritis. And ultimately, if you do not treat this gastritis carefully early in the process, then this particular process of gastritis can lead to ulcer formation both in the stomach as well as the small intestine, that is the duodenum. So we must have heard of duodenal ulcer or stomach ulcer. This is one of the most common reasons for that. Having said that, gastric reasons are mainly the bacterial infection, contaminated food, water, and other irritants in the social life. People consume alcohol, tobacco, all this can trigger a lot of inflammation of the stomach. So these are some of the major causes for gastritis and gastric complaints and discomfort. There are patients who also complain that they cannot tolerate spices or chilies. So what happens is that traditionally when the superior or the main layer which is protecting the stomach gets eroded, it gets immediately, the stomach becomes very sensitive, and then the patient develops symptoms even on the slightest injury uh, with the slightest injury of the chili or the spices which people take. Somebody has asked, what are the side effects of endoscopic surgery? Now, side effect, I won't say it is a side effect of endoscopic surgery. I would say the endoscopy has two aspects. One is endoscopy can give you diagnosis, and then endoscopy itself can help you treat a problem which is there in the food pipe, stomach, small intestine, large intestine, bile duct, even gallbladder, and pancreas. So there are complications which can happen because of a diagnostic or a therapeutic endoscopy. Now, it is beyond the scope of this today's live session for me to describe the complication rates, but I want to share with you that it has been traditionally our practice that we want to work on a zero complication profile. So, in over 100,000 endoscopy, if you look at the whole statistics, our overall complication rate in our hands, in my hands, would be less than 1% of entire spectrum of very advanced procedures also. So what I'm trying to say, it is extremely safe if done by experts, well-trained professionals, and in a proper environment with proper infrastructure, equipment, accessories, anesthesia support, and overall technical support from the assisting team. So yes, endoscopy can have side effects like complications, but if done properly, it's an extremely safe procedure. Somebody has asked that I have less appetite. Is that a warning sign? Well, as I say, less appetite. When do you have less appetite? When there is something wrong in the stomach, and when the food enters the stomach, you feel little discomfort or postprandial, we call it heaviness. After eating food, some people have discomfort. Okay, they feel very full, they feel little bloated, and then they stop eating, and that's what they refer as less appetite. So these are the common causes of people who don't want to eat more, because the moment they eat, they have fullness and discomfort. So yes, stomach inflammation can lead to that, but there are certain conditions. There are certain deep infections which can lead to loss of appetite. One of the most common cause in our country is tuberculosis. So people who have tuberculosis, either of lungs or intestine or lymph nodes, they do have loss of appetite, number one. Number two, they will have low grade fevers in the evening. Number three, they may have associated symptoms. So, yes, if loss of appetite and loss of weight with fever is there, yes, patient will require investigations for sure. So that answers the question number two. Shubham Mishra has asked me this question. Now we will go to the diagnosis and treatment of gastric problem. As I mentioned earlier, endoscopic techniques have revolutionized the entire concept of digestive disease management. So what does this mean? That when I was training as a postgraduate student about 25, 30 years ago, there was a dictum that big surgeons take big incision on the abdomen. The paradigm has shifted in the last 3 decades, which now tells that good surgeons or good doctors or gastroenterologists do not take any incision on the abdomen. What does this mean? That the technological improvement and evolution has helped us to take care of a lot of digestive issues, both diagnosis as well as treatment, very effectively without the need for even laparoscopy or open surgery. In fact, today I did a case of a 28-year-old young man who has something called Peutz-Jeghers syndrome. Now, this is a familial polyposis problem. These patients develop polyps in the large intestine, small intestine, stomach, everywhere. And this is a genetic defect which leads to this kind of an issue, a mutation. So, this young man was having blood in the stools, and we managed to take out almost 1.52 centimeter size, 8 polyps in one sedation in about 45 minutes' time. So this patient has avoided a major surgery today because of an endoscopic intervention. So what I want all of you to understand is that whenever you hear anybody talking about surgery on your abdomen, you have to ask yourself a simple question. Can surgery be avoided? Can we have other means or treatment options available today in 2022? Because we have been doing this endoscopic surgical procedure in my career for last over 2 decades. And I can assure you, ladies and gentlemen, that vast majority of common people are unaware that today there are so many endoscopic procedures which can obviate the need for any open or laparoscopic surgery. So this is a very fundamental information which I want to give you today. What are the common foods? Somebody has asked me a question which can cause gas, acidity, and dyspepsia, we call it in our medical language. So, somebody has asked me, hello, sir, is endoscopy essential for effective management of upper GI disease? Well, we will talk about it, but first I want to talk about the food. The food, most common food, if you ask me honestly, is outside food. People who are eating regularly out of their home food, they are more prone because we do not know the quality of food. We do not know the quality of ingredients. We do not know the quality of oil or butter or ghee or whatever they use in preparation of those foods. And these are some of the reasons why a lot of people who eat outside are more prone to digestive problems. So, first thing, if you want to really stay healthy, the gut wants to stay healthy, you avoid outside of your home food completely. Homemade food, and in fact, I'll go one step further. See, there has been a traditional knowledge that people who ate their food, what their ancestors ate, usually were very healthy, and they are healthy. If you look at villages where there was no penetration of Western lifestyle, or all these major American brands of food, of fast food, are not there, you have seen that they enjoy overall a very healthy life. They don't go to doctors or hospitals that frequently. In fact, I had seen a patient from overseas, from Kampala, and it was a very interesting discussion with that patient. And he said that there are no hospitals which are required, which are major hospitals in Uganda and places like that, because they eat very, very natural food. They don't even eat salt in their diet. So majority of the patients in Uganda, they don't even have specs. They don't have eye problems. So what I'm saying, diet is extremely important, but you need to avoid outside food. There are excessive spicy, oily, deep fried food. Definitely you should avoid. And as I said, somebody has asked, is essential for effective management of upper GI diseases? Of course, upper GI diseases are related to food pipe, stomach, and the first part of the small intestine, that is duodenum. In fact, we did yesterday at Surya Hospital a resection of multiple small tumors in the stomach of a 68-year-old gentleman endoscopically. We removed almost 4 of the lesions there, and I think this patient will have a very, very good outcome because he will avoid surgery. So what I'm trying to tell you is that yes, endoscopic diagnosis, high definition, high resolution, magnification endoscopy is now a routine procedure in our hands. So a routine endoscopy, believe me, in Japan, almost 40 to 45% of patients who are suffering from digestive cancers like esophageal, stomach, or the colorectal, they all are subjected to early detection, diagnosis, and treatment with endoscopy, and they avoid surgery. So this is something which we need to understand in our country, that endoscopy is just not for the purpose of diagnosis. It is the first step towards a proper, effective, non-surgical treatment of a digestive problem. So this is something which I would like to share with you. There are difficult cases in all fields of medicine, and so is with endoscopy. There are extremely difficult procedures which we do. Uh, there, according to my assessment of training, which we have trained more than 450 gastroenterologists from 35 nations, I can tell you that there are 16 to 17 tiers or levels. I'm sure you have played computer games, so you know up to level 6 is the most complex computer game. So similarly in endoscopy, we have almost 16 to 17 such tiers of endoscopy diagnosis and interventions. Fortunately, we have almost the entire spectrum of these tiers of endoscopy at our disposal over here at Surya Hospital. So, difficult procedures uh, can be made easy with the cooperation of patient and expertise of the doctor in a safe environment. So yes, there are difficult procedures, there are difficult cases, and you have to manage them effectively, keeping in mind that we should work on a zero complication profile. Now, complications will happen, but if you are very careful, I can assure you they are absolutely at bare minimum in our experience over the last 2.5 decades. So yeah, that was a question. Now, somebody has asked me, what is the USP of this center? So behind me, you can see Surya and WGI. It's a center of excellence. You can see here in gastroenterology and endoscopy. Now, what does it give? It gives whatever is currently available in the world in the field of flexible endoscopy, in the field of gastroenterology. So, be it the problem with food pipe, be it with the stomach, be it with the small intestine, large intestine, bile duct, liver, gallbladder, and pancreas. So, there are so many applications of endoscopic diagnosis as well as endoscopic treatment. In fact, I'll go one step further to inform our viewers today that endoscopy is making a major inroads in even field of bariatrics, that is obesity. So I think in the next few years we will have specialized devices like staplers, which can be used the way laparoscopic surgeons and open surgery use staplers. We can use such staplers to do endoscopic bariatric procedures much more safer, much more quickly, and more efficiently with proper outcome comparable to other modalities of treatment in obesity. So this is something which I feel that the whole world is looking for in terms of advances. I would like to share with our viewers today that if there is one surgery which has gone down by 50%, elective surgery in the developed world. When I say developed world, I'm talking of United States, North America, I'm talking of Europe, UK, Australia, Japan. I'm talking of those nations where they have a colon cancer screening program. They have managed to cut down the need for elective colorectal cancer surgery by 50% in last one decade. By 50% is a very significant drop. And I personally reckon that in our country, those figures are not even 0.1%. So this is something which we need to really work on. So those viewers who are watching today, if anybody has a digestive cancer in the family, you need to be very vigilant after the age of 45, especially colorectal cancer. So anybody having a large bowel cancer or a stomach or esophageal cancer, they need to be on a very, very quick response in terms of symptoms, and they need to address the problem immediately. We have one question, I think. We'll just try and see what is the question. Just a moment. Yes, a capsule endoscopy. Can endoscopy be done with capsule? Now, see, you have to understand capsule endoscopy is essentially for the small bowel evaluation. So, if you want to evaluate the entire small intestine, then capsule will give you a detailed information. And now there are much better quality of images and videos which can be produced with capsule endoscopy, high resolution, that small problems can be detected with capsule. However, the limitation of capsule currently is that you can't do any therapeutic intervention. You can't treat a bleeding ulcer with that. You can't take a biopsy with the capsule as of now. So there are certain limitations of diagnostic ability or therapeutic ability of the capsule endoscopy as of now. But I'm sure as time advances and as more technology advances and evolution will happen in that technology, where we will have mini robots, which will probably allow us to do those interventions which are currently not possible. So yes, capsule endoscopy can be done, and it is mainly for the diagnosis of the small bowel in problems. At Surya WGI, we have the entire range of endoscopic abilities, including capsule endoscopy. Yes. So coming to the final few minutes of my discussion today, once we come to this half an hour session of live, I want to reiterate to those patients who are sitting on their gastric symptoms for years on end. So don't do that. You need to diagnose the problem early, because if you do not diagnose them in initial stages of your symptoms, you will allow this disease to become chronic in your body. So a healthy gut will lead to healthy mind. And this is what we have seen, that people who have gas trouble, people who have constipation, people who have acidity, people who are not feeling well in their digestive system, they are usually highly irritable, stressed, upset, and a lot of them are even depressed. So, what I'm trying to tell you, what do you mean by gut feeling? The gut feeling is the gut and the mind has a direct access. It's an axis. You need to work, they work in tandem. I always say that the gut and the mind are constantly in dialogue. They talk to each other. So if you want a healthy mind, you need to keep a healthy gut, and vice versa. So gut and mind, they both work in tandem. My request to those people who are highly stressed in their lives because of various reasons known to them, it will directly affect your intestine and your digestive system. So this is something which I think our viewers should know today when we are talking of a introductory presentation on gastroenterology and endoscopy. Now, coming to the lifestyle which we live in urban centers can contribute immensely to the problems. Uh, Irregular meal timings, uh, excessive traveling, exposure to fumes, exposure to outside food, typical rat race environment of an urban life, deadlines, timelines, those are all contributing factors which will lead to a digestive challenge or a problem. So, therefore, ladies and gentlemen, it is my humble request to all of you that work is part of your life. Work is not your life. So, you need to have a distinction there, and people have stopped living life at the cost of being very busy for work, and that has caused the problem. So my request to especially the young viewers today, I tell people, don't take yourself so seriously. We are speck in the entire cosmos. Our existence is very, very fragile and brief on this planet, and therefore cut down your psychological stress and nonsense. It will heal your stomach much better. So if you want to stay calm, practice pranayam, yoga, meditation, and regular physical exercise. Now, these are some of the lifestyle changes or modification which I would suggest all our viewers today because I myself do it. So, I do twice a day, I try to do my yoga practices. And this has immensely helped me in my life to keep the sanity, especially when you have a massive pandemic going around. So coming to pandemic, I want to share a few details on pandemic for the digestive tract. Now, 29% of patients who are affected with COVID may develop digestive problems. They have never had digestive issues, but after getting COVID infection, they all of a sudden develop some stomach upset. They start feeling discomfort. They start having diarrhea. Some will have nausea feelings. Some will have abdominal cramps. So if anybody who has undergone a COVID infection and it was a mild to moderate infection, and if they developed any digestive symptoms, they need to get investigated because a very small subset of patients within that which we have seen in our practice where there is an embolus or blood clot which goes and blocks the intestinal arteries, and that can lead to serious life threatening complications. And we have reported this in the newspaper also about a few months ago. I think 6 months ago I have reported such incidences on television as well. So my request to you that anybody who has post-COVID digestive issues, those digestive symptoms should not be ignored. So this is something which I want all of you to pay attention, especially in the pandemic era. Coming to other chronic infections, my personal feeling here is that the way virus infection is endemic in our country, so is tuberculosis, tuberculosis of intestine. Tuberculosis outside the lungs is a very, very common problem in our country. This leads to fever, lot of loss of weight, lots of appetite, and they just don't know what to do. So these are the patient who needs proper digestive evaluation. Today is not the scope for me to talk about gallbladder stones, pancreatic diseases, and other complex problems of our digestive tract. However, in our subsequent live session, I'll try to pick one particular subject like gallbladder stone or pancreatic disease or cancer in digestive tract, and we'll try to address those problems again with all of you live, hopefully soon once our team coordinates the live event. With that, I would like to thank all of you for your patience and presence today. Thank you very much. Namaskar.